Hey everyone, welcome back to CBC News BC. I'm Wendy Cocchia. We're here in the Vancouver newsroom, and here's what we're following this afternoon. Well, BC Conservative leader John Rustad is proposing a carbon tax on U.S. thermal coal that is shipped out of BC ports. And he says he wants to use that as leverage against threats of American tariffs on Canadian softwood lumber. He says the higher costs on thermal coal would help bring the U.S. to the table.
But at the end of the day, we don't need U.S. thermal coal. We don't use it. That carbon tax would start off relatively small and would scale up over the years, and all of that should then go into a trust as opposed to as a government revenue. With the intent being is to use it, quite frankly, just as our softwood lumber duties are put in place, to use it as leverage to actually get the Americans to the table to do a deal.
Rustad also proposed a ban on American funding for BC environmental activists, and he says they have wasted police and courts' time and dragged resource industries through costly litigation. Also, the emergency department at the Delta Hospital has reopened, and it reopened this morning, but it was forced to close for 2 nights in a row this weekend. Fraser Health says the closures were because of physician staffing challenges. It was closed overnight between Saturday and Sunday, and then again until 6:30 this morning. The mayor of Delta says that he's very concerned that this issue is going to get worse.
My real concern is if this extends to a 24-hour period, that would mean that we would have to transport people seeking medical help outside of Delta. And as you well know, if it happens in the afternoon, it's major congestion throughout our city. The tunnel is only 1 lane north. And of course, Alex Fraser is jammed at that time too. So my concern is if it's 24 hours, we have a serious problem here in Delta.
And Fraser Health said that nurses were still assisting walk-in patients with basic first aid and transferring urgent need patients to other hospitals. The mayor says he's set up an emergency meeting with council to make a decision on what the next steps are. And also today, watch out for strong winds that are expected tonight. Much of Metro Vancouver and parts of Vancouver Island are under a wind warning. Environment Canada says a low-pressure system will approach Vancouver Island this afternoon and evening. Those winds are expected to hit 70 to 90 kilometers per hour. They might topple trees or cause damage, and they will ease off by tomorrow morning. Now, for the first time, BC elected a majority female legislature in 2024. And this Black History Month, the government of BC has highlighted Rianne Gasper from the Abbotsford Mission riding, who was among the first Black MLAs to be elected in decades. Now, she says minority representation helps create space for the next generation of Black leadership.
This is all about the young people, the legacy that we are leaving, and they are looking to us as leaders. So when they see representation, it inspires them, it encourages them to dream big, to believe the impossible, to know that they can be in places of leadership like government and represent well.
She says some of her key priorities are staffing issues at the hospitals, the drug crisis, homelessness, and supporting small businesses. Meanwhile, Nanaimo-Lanceville MLA George Anderson was also elected, and they both are the first Black MLAs since Emery Barnes left politics in 1996. And that's it for now. I'm Wendy Cocchia. You're watching CBC News BC. Stay with us. BC Today is up next.
Good afternoon. Thank you for joining us. Well, emergency room closures dogged hospitals in 2024, and they continue this year. Delta's ER was closed for some time this weekend. How has the shortage of physicians affected your ER visit? And what's needed to recruit and retain more doctors in BC? After 12:30, are you jumping on the Buy Canadian movement? And how sustainable is it? What are the items that are easy to replace and what are harder to switch up to a made in Canada brand? I'm Michelle Elliott. Welcome to BC Today. Emergency department closures at hospitals in Merritt, Clearwater, and Delta over the weekend are highlighting the ongoing doctor shortage in BC. Delta's ER was closed on Saturday night into Sunday morning, as well as last night until just this morning. Meanwhile, ERs in Merritt and Clearwater were also closed Sunday night into this morning. Well, sporadic emergency room closures plagued hospitals throughout 2024, hitting hospitals from Dawson Creek to Kitimat to Port Hardy. Last week's BC Throne speech highlighted a plan to address the issue by looking south of the border. Here's BC's new Lieutenant Governor Wendy Cocchia.
In the past 2 years, British Columbia has connected hundreds of thousands of people to a primary caregiver, to a primary care provider. More are being connected every day, and yet we know there is so much more we need to do. Your government will work with regulatory colleges to ensure trained healthcare workers from other countries have their credentials recognized faster. That includes attracting the best and brightest medical professionals from the United States who are already drawn to the benefits of our public healthcare system.
That's BC Lieutenant Governor Wendy Cocchia from last week's Throne speech. We're asking you what is needed to recruit and retain doctors in BC. What do you think of that plan to attract doctors from the United States? Why do you think it's so hard to keep doctors across the province? And let us know as well, what's your own experience? Has the shortage of ER doctors affected an emergency room visit that you've had? 1-800-825-5950, 604-669-3733. You can hit pound 690 on your cell phone. You can also email bctoday@cbc.ca. Joining me now is Dr. Joss Reimer. She's president of the Canadian Medical Association. Good afternoon, Dr. Reimer. Thanks for being with us.
Oh, thanks so much for having me.
Well, another hospital closure in Metro Vancouver this weekend and two more outside the Lower Mainland. Persistent ER closures across BC over the last couple of years. What are your thoughts on how common these have become?
Well, that's just it, is that we're not really tracking, nobody's tracking exactly how common these are. But what I can say is that this used to be something that was almost unheard of, at least in urban locations. And now it's something that we're seeing from coast to coast in all settings. And so it's really concerning to us who are trying our very best to staff those hospitals, those emergency rooms, to see that these closures keep happening. And it's something that the Canadian Medical Association is certainly concerned about.
What does that tell you then about the shortage and how severe it is?
Well, then that's absolutely the issue. We have shortages of physicians, of nurses, of respiratory therapists. These problems are big, and there's a lot of reasons for that. You know, we like to look at COVID, and obviously that's caused a big strain on the health system and led to a lot of people retiring or decreasing their hours or looking for other types of careers. But these problems started long before that. In the 1990s, for example, there was the thought process that we had too many doctors, and so we decreased the class sizes of medical schools across the country, and that's part of what's causing the problem right now, where the people who would be at sort of mid to late career, we have a lot less of those folks. And we have a lot of people who are the baby boomer generation and are either already retired or getting ready to retire at the same time that we have baby boomers who need more care because their health is getting more complex. So there's a lot of things happening at the same time, but it's all leading to the same issue where we're seeing shortages across the country.
You know, you mentioned an aging population. I was at an emergency room in recent weeks and waited 6 to 7 hours. At one point, there was no doctor on the floor because she was pulled away to deal with a very severe case. And so there was sort of all hands on deck for that case. And so that led to the very long wait. And when I was asking about it, they did say that there's the pressure of, more complex care as well that's needed. So when you talk about the impact of the shortage on ERs, it's not necessarily just closures, right? It's also those long wait times. Can you describe for me what it looks like on an emergency ward right now?
Well, there's no question that we're seeing wait times that are far too long for what Canadians need. And none of us who work in the health system want to see that. We do this work because we want to provide care to Canadians. And the problem is in multiple areas of the health system. We just saw a study come out from Health Canada that said that we are in Canada 23,000 family physicians short. And when you don't have a family physician, you don't have that primary care provider, you either have to get your primary care somewhere else, and often that ends up being an emergency room, or the things that could have been managed and could have been prevented at the primary care level get more serious and more complex. And then you do need that level of acute care. So people are coming in with more complex needs because we have an aging population and because we have a population who doesn't have sufficient access to primary care. And that is causing stresses on the docs who are working in the emergency room because they're trying to be a bit of everything, be the family doc, be the emergency doc. And then when they can't get beds up on the ward, they're also having to be the hospital doc as well, which is something that they didn't really train for. And that leads to burnout, which leads to less people wanting to do the job. And we get this sort of cycle where more and more people are stepping away, making the situation worse.
I will say that doctor and the nurses were nothing short of professional when they did have time to finally see us. Let's take some calls here. My guest is Dr. Jost Reimer, president of the Canadian Medical Association. And in light of more ER closures this past weekend at Clearwater and Merritt and in Delta, we're asking you, has the doctor shortage affected an ER visit you've had? And what do you think is needed to recruit and retain doctors in BC? Our numbers are 1-800-825-5950, 604-669-3733, and you can hit pound 690 on your cell phone. Pete is calling from Vancouver. Hi, Pete. Tell us about your experience.
Hi. I think what no one is talking about is the long COVID burnout elephant in the room. It's not just the fact that if you get COVID in a hospital as a patient, you have a 3 to 13% death rate, huge UK study showed. It's all of these healthcare workers that for years went without masks because Dr. Henry's libertarian freedom to infect disease spreader was more valuable than our health. Now, even with the mask mandates, it's only leaky surgicals. They're not N95s. They're not going to protect you from aerosol. So even getting more doctors and nurses, which we do need, is not going to make a difference if we keep burning people out, because the Stats Canada study showed that long COVID risk is cumulative. By the third infection, 38% have long COVID. So they work less, they take more time off, they work part-time, they burn out. They just decide, I don't want to go through this. So the BC NDP need to change their policy, protect our healthcare workers from COVID and all the other aerosol disease with mandatory N95 masks, including doctor's office, because if they're constantly burnt out, do you want to work in an environment, hospital or not, where the management doesn't care about your life or your health? You're a disposable cog.
And as I understand it right now, there is masking required at hospitals, but I don't think it's N95.
No, leaky surgicals. And they don't check for it. They don't even check. I've been in the hospital. Like most of the people aren't wearing it. They're not checking for it. It's like, hey, we're going to have speed limits, but we're not going to have cops looking to see if you're following them.
Okay, Pete, thank you very much. And so, Dr. Reimer, what do we know? He's talking about long COVID there, but what do we know of what's contributing to burnout when it comes to healthcare workers?
Well, there's no question that long COVID is one of the things that's contributing to the issue, because that's something that we didn't have before COVID. And then we're also seeing a lot of people, partially because of their stress during COVID, who are getting vaccinated less. And so we're seeing measles reappearing, and we're seeing other vaccine preventable diseases reappearing. So there's a number of different things that are within the public health world that are also contributing to the issue. And so it is critical that we all work together in the same direction to try to protect Canadians, protect our health workers. But that's not the only thing. We also have things like administrative burden. We know that our family docs, for example, spend 10 to 19 hours a week doing paperwork. So whether there's COVID or not in their day-to-day work, they're still being pulled away from patients for almost half of their work week in some cases. And that's something that we need to find solutions to. We need to have better communication between our computer systems. We need to get rid of some of the forms that we have to fill out. We need to get rid of sick notes. There are a lot of solutions that we can implement. And so we're trying to work with governments to look at every angle, because we know that there's not one solution that's going to address this
Sure.
problem. It's been brewing for many years.
And in BC, they have taken some of those steps, right, when it comes to compensation for family doctors, as well as the sick notes. As far as I understand, that they're lessening the requirement for that.
Yeah, and we'd like to see them just gone completely for those short-term illnesses, because they don't benefit anyone. If you think about yourself, if you have a migraine or you have a cold, the last thing you want to do is leave your house to have to go see a doctor to get proof that you had a migraine. We really just want people to rest, get better, get back to work. It's not good for any of us to have that. So we are hoping that all governments can put in regulation to stop the need for all of the short-term illness sick notes. And not even compensation is wonderful. We're really happy to see if physicians are paid for that time, but we'd rather just not do work that isn't benefiting our patients.
Speaking of Port Hardy, I mentioned it in my introduction. Aaron wrote us an email. In Port Hardy, our hospital is closed from 4 p.m. until 8 a.m. every single day. So if we have an emergency, we have to go to Port McNeill, which is 30 minutes away. And that certainly was one of the hardest hit hospitals from last year, and it sounds like into this year as well. Let's take another call. Jennifer is on the line from Vancouver Island. Hi, Jennifer.
Hi.
Hi. What do you think is needed to recruit and retain more doctors?
Well, I feel I'm a recent nurse graduate on Vancouver Island, and I'm not a doctor, but I work with doctors, and I feel that recruiting nurses and doctors from the States, especially or somewhere else, is not, I don't feel that's a solution, because all you're doing is paying them twice as much as what you're paying the doctor who's working right beside them. And so that's why they're losing so many doctors and nurses here, because they're going someplace where they are paid well, what they should be, and definitely not more than they should be, but they're filling a spot so they're not overworked. Like for me, as a nurse, just a recent graduate nurse, you're supposed to have 4 patients. Every nurse is supposed to have that. But you have rotations where you have 7, always 7. So there's not necessarily a shortage of nurses or doctors here. There's a shortage of people who are willing anymore to work like that, because not that you don't care about your patients or love the work you do, it's you're terrified to make med errors. Med errors are the biggest problem worldwide, and it's usually from fatigue. So if you keep doing that month after month after month and have an overload of patients, have terrible pay, really. Like to be a nurse to make $32 an hour, you can work on a tugboat and make 40 with zero education, and you don't have to pay all the fees and membership fees to be a doctor or a nurse. Like in Europe, it's free to go to school to be a doctor or nurse. They pay you to do stuff. Here, it is like cost after cost after cost, and then you work hours and have to work extra hours because there's no nurses, and you have so many patients.
Wow.
So that's the problem. If you're bringing people in, you're not solving a problem. You're just paying somebody more money than you're going to pay the people that already are
It's
here.
the working conditions that are the challenge of retention. Jennifer, that's a really important point to make. And you have just graduated as a nurse. You're starting your career. Do you worry about burnout?
Yeah, I do, because you don't have the option. If you want to secure a full-time position in a hospital, you have to work the 4 rotation. If you have to work 2 days and then 2 nights back to back. Sometimes, for me, I had to do my preceptorship for 4 months. Not once was I able to fall asleep on the first day. So you're working, and many of my colleagues, the same thing. You're working with zero sleep on your third shift, which is the first night. And then you try to do it, sleep the next day, and then you're working that. Then you get basically 2 days off, really, because you have to prepare for the next one. And then it's back at that again. You don't have the option to just work days, just work nights. Like a lot of people would work 5 days a week that not just 2 days and then 2 nights. There's lots of people willing to work lots of shifts. I mean, it's terrible that there's that many patients, but if you had people that could have hours that was more work-life friendly or even just suitable, because it's weird that it's healthcare providers and pilots, for another example, are the people that are given the shifts that have the worst burnout. Like and to be an ambulance, a helicopter pilot, say, or driver, you have to do the same thing, 2 days, 2 nights.
Jennifer, you raised the alarm on a really important issue, which is what the conditions are and how those are going to be addressed, the working conditions for healthcare workers. Thank you so much for that, Jennifer from Vancouver Island, who is a recent nurse graduate. Ian is next in Penticton. Hi, Ian. Welcome to the show. What are your thoughts on what's keeping doctors away or away from the profession?
Well, I'm of the mind of more training as opposed to recruitment. Like our population is growing, and we're taking doctors from, let's say, Alberta or the States.
Right.
So really, we're robbing Peter to pay Paul. And as our population expands, so should the seats in our medical schools. Not only like the lady before me said, but the nursing, the nurse practitioners, the doctors, the care aides, the whole spectrum, I believe should be increased. Like I know of 5 people who have been trying to get into medical school since graduating university with various science degrees, and to a person they've all been declined. And some of them have the MCAT scores in the 518, 520 range. Like they're high, super brilliant people, and yet they've applied and they've applied and they've applied, and they've been turned down. I just don't understand that mentality of recruitment as opposed to training.
Yeah, that's a
really... I'm
Yeah.
sorry?
Go ahead. It's a really interesting point. Yeah.
Yeah, I just think that, in Penticton, if we train people who are interested and meet the requirements, of course, to get into med school or nursing school, they're going to want to stay in Penticton as opposed to recruiting somebody from Bellingham or from Colorado or wherever these extra, and they're not extra, of course, but doctors are coming from. It just doesn't make any sense to me on a bigger macro kind of scale.
That's a long-standing criticism as well of the number of seats at medical schools. And there is that SFU School of Medicine, right, that is in the works. The new school has named a dean, and they aim for first classes by 2026. So that's a plan to try and address the lack of seats at medical schools. Thank you very much for that, Ian. Shirley is next now at Williams Lake. What's needed to recruit and retain healthcare professionals, Shirley?
Well, we're pretty fortunate here as we have some really terrific doctors, and our ER works extremely hard, and so do our nurses and doctors in Williams Lake. They're part of the problem, I think, is that we have a lot of patients in our hospital who are mental illness patients, and we have a lot of seniors who get dropped off in our ER situation because people can't handle them at home anymore, and there's not enough facilities to put patients and a lot of seniors into a decent home, or there is no seniors living complexes in Williams Lake that hold enough people. So they get dropped off at our emergency rooms, and we have many people who are in our hospital who shouldn't be in the hospital. They should be in some sort of facility where they can be better taken care of.
That goes to the complex care needs that have certainly grown. Shirley, thank you very much, Shirley at Williams Lake. Dr. Reimer, what then do you make of this proposal to try and attract more healthcare professionals from the United States? As they say, well, President Donald Trump is making changes to the healthcare system there. It may be more attractive for them to come up here.
Well, I don't think this is an either or question. I think at this point it needs to be an and. So I agree with all the callers. We need to increase our class sizes. Now, the average family physician has 10 years of post-secondary education. They have 4 years of medical school, 2 years of residency. That's not a quick solution to increase our numbers, but it is a solution we need to be doing at the same time. So we need to be making sure that those physicians who are already in Canada and have licenses from other countries, but maybe not recognized here, we need to make sure that they're being integrated into our system at the same time. We need to be using things like physician assistants to try to decrease the amount of work that physicians have to do and bring in a whole team-based approach so that if you go to your primary care doctor, that maybe you're going to see a dietitian or a physiotherapist who works together with the pharmacist and the nurse practitioner and the doctor and provides care all at the same place, sharing a health record. All of these solutions are important. We need to invest in the communities so people have home care or long-term care facilities that they can go to when they need some extra support and don't need a hospital bed, but do need more support. This is an urgent issue. And when we're 23,000 family physicians short across this country, we need to be working on all of these solutions at the same time.
And the Canadian Medical Association has your own proposal to make it easier to move provinces.
Absolutely. So we know as well with what's going on in the US, there's been lots of talk about reducing interprovincial trade barriers and interprovincial labor mobility. And we'd like to see physicians be able to move from province to province without having to apply for a new license, going through that paperwork, paying thousands of dollars. Because then if, like you have right now, some emergency rooms that are closing down for a short period of time, maybe there's a Calgary doctor who has the weekend available and could come out, but they're not going to pay thousands of dollars to help out for a weekend. They might come though if their license was just recognized. So this is another solution that we want to see and that the Atlantic provinces are already doing. Right now you can pay an extra $500 and you can work in any of those 4 provinces on an ongoing basis. So there are possible solutions that we can do in many different areas at the same time.
We'll certainly follow up with the health ministry here. We did request an interview with Health Minister Josie Osborne, who was not available. But really good to hear your thoughts, your perspectives, and your ideas this afternoon. Dr. Joss Reimer, thanks for your time.
Well, thank you so much for having me.
Dr. Joss Reimer is president of the Canadian Medical Association. As I mentioned, the health minister, Josie Osborne, was not available for an interview with us. We'll try again for a future interview, and you can keep sending your emails, bctoday@cbc.ca. It is 12:28 now here on BC Today. Now, another story we are watching closely is in Rome, watching for updates on the health condition of Pope Francis. Now, the Pope remains in critical condition after having spent the weekend in hospital battling double pneumonia. But the Vatican says the 88-year-old pontiff has shown some slight improvement and remains alert, and that he hasn't had any more respiratory crises since Saturday. Now, he has resumed some work, including making a call to a parish in Gaza earlier today. This week, word emerged that he showed signs of kidney insufficiency. The Vatican, though, says that prognosis remains guarded and was not causing alarm at the moment. Still, doctors say the main concern facing Pope Francis is sepsis, which can occur as a complication of pneumonia. And we are watching that story closely here on CBC. And you can keep watching for updates on our website. That's cbc.ca/news. You can watch CBC television on Newsnet as well. There are constant updates from CBC reporter who's based in Rome. And that's CBC reporter there. And as well, lots of updates on our website. Megan Williams is there reporting, of course, and as well CBC Radio 1. Keep it locked to CBC Radio 1 for more updates on the condition of Pope Francis. Thanks very much for being with us here on BC Today on CBC Radio 1, CBC Television, and live streaming as well on the CBC News app and on YouTube. Just search for CBC British Columbia. I'm Michelle Elliott. Very nice to be with you. this Monday afternoon. And coming up in our next half hour, we're going to talk about that seemingly growing Buy Canadian movement. And we'll ask you, is that something you're trying to do? Are you trying to change your shopping habits to buy made in Canada products? How sustainable is it? How long do you think you can keep it up? And you can let us know as well what's been hard to replace, what's been easy to replace. We'll talk to someone who's been tracking Made in Canada products and Canadian businesses, as well as a retail analyst on the show coming up in a few minutes. Right now, it is 12:30 and time for the CBC News with Rob Zimmerman.
Good afternoon. Conservative leader John Rustad says it's critical to reach a deal with the U.S. on softwood lumber. He says one way to put pressure on their government is to impose a fee on U.S. thermal coal that's shipped through BC ports. Rustad also wants a ban on U.S. money being used to fund BC conservation groups that are fighting resource development in the province. Delta's mayor says the closure of the emergency department at Delta Hospital is deeply concerning. As we've been hearing on the show, the entire emergency department was closed twice over the weekend due to what Fraser Health calls physician staffing challenges. Mayor George Harvey says the health authority did not inform the city of the staffing constraints or of the closure. And the Musqueam Indian Band has reached a revenue agreement connected to Vancouver International Airport. The federal government has agreed to share a percentage of ground lease revenues with the Musqueam that it collects from YVR. The agreement is expected to provide a consistent flow of income to the band. And now the BC forecast. Much of Metro Vancouver and parts of Vancouver Island are under a wind warning with strong winds expected tonight. On the north coast, showers this afternoon, windy as well with a high of 7, highs to 6 degrees with a mix of sun and cloud in the piece. In the central interior, some sun and cloud with a high of 8, highs to 7 with increasing cloudiness in the west Kootenay, mainly sunny in the east Kootenay. In the southern interior, mainly cloudy with a high of 7 as well. And for Metro Vancouver, Greater Victoria and the Fraser Valley, periods of rain this afternoon with highs around 12. That's your CBC News update from Vancouver.
Thank you very much, Rob. It's Rob Zimmerman in the CBC Vancouver newsroom. Welcome back. You're with BC Today, and we're going to update you on another story now internationally. 3 years ago today, Russia launched its full-scale invasion of Ukraine. And this anniversary comes as Ukraine's relations sour with the United States administration. U.S. President Donald Trump has called Ukrainian President Volodymyr Zelensky a, quote, dictator, while excluding the country from peace talks with Russia. Prime Minister Justin Trudeau is in Kyiv today, joining more than a dozen European leaders in a show of support for Ukraine. He pledged more aid and military equipment, saying Canada will do what it can in order to enforce a peace deal.
Regardless of the great distance separating our two countries, Canada knows this is a war that we cannot afford to ignore. I know the stakes. Canadians know the stakes. All of you around this table know the stakes. And most of all, Ukrainians know the stakes. And we know we're going to have to continue to do more and more in an uncertain world, and Canada will be there. As to how we will be there, we will work with our neighbors on it, but everything is on the table because we need to make sure that might no longer makes right in this world.
Now, BC's premier and other politicians, we're going to talk about them in a little bit as well, about the Buy Canadian movement. That's Prime Minister Justin Trudeau speaking earlier today. We have an email on the doctor shortage, and we heard about the need to expand seats at medical schools. Well, we heard from someone who graduated, had dreamed of becoming a doctor, but couldn't with a 3.6 GPA and apparently not enough extracurriculars to beef up their application. Thank you very much for sharing your story. BC Today at cbc.ca. It's 12:35 now. Thanks very much for joining us here on BC Today. I'm Michelle Elliott. Well, Premier David Eby, other politicians and premiers as well have been urging Canadians to choose to buy locally made products in light of the U.S. tariff threat and of Donald Trump's 51st state provocations. It seems Canadians are responding, but there are some challenges. Here are a couple of people speaking to CBC reporter Lindsay Duncombe.
Buying more Canadian, looking where is it coming from, trying to do more local, and maybe more from Mexico, Peru, something like that.
Why is it important to you?
Supporting Canada. It is. I'm proud to be Canadian, and I think it's important to support our country.
Yeah, I think it's also like buy Canadian and also produce Canadian. I think that's the other side of it, because there's just there's classes of products that just aren't made in Canada, and I think that's one other issue that I think Canadians generally will have to grapple with going forward, because there's some things that if you wanted it, you couldn't buy Canadian if you wanted to, right? So.
Now, the Buy Canadian movement, as you heard, can also prove to be challenging. The labeling of products can be complicated. Some Canadian-made items may be harder to find or perhaps more pricey. And it can be harder for smaller retailers as well to make the switch. So we're asking you, are you trying to change your shopping habits and buy Canadian? How long do you think you can keep it up? And what other items would you like to focus on? And is that movement sustainable? You can call us 1-800-825-5950, 604-669-3733. You can also hit pound 690 on your cell phone. And you can email, if you like, bctoday@cbc.ca. I have two guests with me for this conversation. Shannon McDougall is the creator of the Facebook page Made in Canada Directory. She's with me here in studio. Hello.
Hi, Michelle. Thanks for having me.
Thank you very much for coming in. And Bruce Winder is a retail analyst and an author as well, and he joins us from Toronto. Hi, Bruce. Thanks for joining us.
Hi, thanks for having me on the program.
Let me start with you, Shannon, because this is something you took on personally, starting this Facebook page. And tell us how it all began.
The Facebook page actually started with the Made in Canada Directory website. And it started in 2018 after the last Trump administration steel and tariffs that were put on Canada.
Mm-hmm.
Through the years, I've continued working on it and adding businesses and being in touch with Canadian businesses.
What's it been like these last few weeks?
It's been very busy.
Yeah.
Since the initial calls from Justin Trudeau and provincial leaders to start buying Canadian, the traffic has definitely increased and people are talking about it a lot more.
What kinds of things are they saying or asking?
Well, I actually put out a question to Canadians, as in what kinds of things are they looking for. And Canadians mostly, it appears, are looking for like cleaning supplies, clothing. Some things that are hard to find are electronics, some electronic brands, some fruits, etc. Yeah, it's mostly about trying to find all of those products.
Yeah. Is it hard?
Some products are, yes.
Yeah.
Some products are very easy. It's amazing how many clothing companies make their products here in Canada. There's over 120 women's clothing businesses that make their clothing here in Canada.
Okay. So things have ramped up in terms of interest then on your page.
Yes,
Yeah.
absolutely.
Bruce, have you noticed that shift?
Yeah, definitely. There's been a lot of action over the last few weeks in terms of companies, consumers buying, looking for more Canadian items, as Shannon mentioned. I mean, if you look at Loblaw, they talked about their earnings last week, and the CEO, Per Bank, mentioned how he's seeing a fairly large shift right now in volume from toward made in Canada items at the grocery store. So yeah, it's kind of everywhere right now.
It's interesting because, yeah, when you go down those aisles, you'll see the signs now, right? Made in Canada. But you also see things like manufactured in Canada, or, you know, a certain percentage of goods of the item is produced in Canada. Can you take us through those labels, Bruce, and what are the differences?
Yeah, there's a few different labels that are in play. You know, probably the two biggest ones are Made in Canada. Made in Canada means that, you know, 51% plus of the value of the product being made happens in Canada.
Okay.
98% of that, when that goes up to 98%, that's called product of Canada. And then you have other things. You have like fabricated in Canada. You may even have designed in Canada. You may have assembled in Canada, you know, packaged in Canada. So I think what consumers are looking for is trying to find products that at least employ some Canadians. That's the key, right? Because of globalization and NAFTA, the former NAFTA and CUSMA, it's very, it's harder now to get products that are pure play Canadian.
Right. I can imagine. So how hard has that been for you to try and determine what goes on your directory?
Well, the first thing that I look at is, are the businesses Canadian owned? Because as we know, as the bigger companies that are internationally owned, the end economy goes outside of the country. So as far as I know, you can clarify that for me. And then I look at all of the products need to be made in Canada. And of course, some like coffee, for example, we don't make coffee beans in Canada, but they're roasted here. And the actual coffee is made in Canada. So, yeah.
Why do you do this?
Well, in 2018, I tried to find made in Canada products, but you could, at that time, there's a lot of resources now, but at that time, I would look for a Canadian made product. I'd go to the site and find it actually wasn't made in Canada. So I thought there should be one site, or there's many now, that have pure information that's more reliable.
And Bruce, why do you think people are making those efforts? What's behind this movement, do you think?
Well, I think that President Trump kind of poked the bear, maybe the polar bear, so to speak, and kind of woke us all up a couple of weeks ago, right? And we feel threatened as a society, right? That, we might be taken over, or we might be feeling some significant economic stress and hardship. So I think Canadians have bonded together and said, you know what, we want to send a message to the United States that, and we want to help our Canadian companies so that we can remain as a strong nation, a strong sovereign nation.
And do you think this goes beyond that kind of symbolism? Can it actually have some kind of economic impact?
Definitely, yeah. There's going to be an economic impact. If you're a Canadian company, you're probably going to see an uplift in sales. And if you're an American company, you might see a little bit of a softening in sales. Now, realistically, we're not a big economy, right, compared to the U.S.
Right.
So it's not like we're going to put American companies out of business, but we might put a little bit of a dent in their sales, right, at least for a little while. And that might be enough for them to put pressure on their governors or put pressure on President Trump to sort of back off on some of these tariffs.
Okay, let's take some calls now. My guests are retail analyst and author Bruce Winder, joining us from Toronto, and Shannon McDougall is here with me in studio. She's created a website and a Facebook page called the Made in Canada Directory, seeing a lot of action, a lot of traffic over these recent weeks. We're asking you, are you changing your shopping habits? And how long do you think you can keep it up, trying to buy made in Canada goods? How sustainable is this movement? 1-800-825-5950, 604-669-3733. You can hit pound 690 on your cell phone as well. Lawrence is joining us now from Kamloops. And what have you found in trying to look for Canadian products, Lawrence?
Well, I've had some luck with it. I mean, as long as it's providing Canadians jobs, like I understand the supply chains are interconnected, et cetera. But as long as it's, the end result is Canadians are working, I'll buy it. And I actually went grocery shopping at Safeway, like quite a big list, and everything I bought at least was, finished in Canada.
Right.
If you will. And the one thing I was worried about was oranges. And so I went to an Asian grocery store, and they have oranges from China. So cause I'm really trying hard not to buy anything from the United States, because this is just so offensive. It's like our family has betrayed us.
And Lawrence, you said you were able to go into a store with a pretty long list, and you pretty much succeeded. You think you can keep this up then?
I'm going to keep it up. Yeah. I'm not going to buy anything from the States.
You're motivated.
Yeah.
Okay, Lawrence.
Strongly motivated.
Great to hear.
It started off as a joke, but it's just offensive now.
The 51st state. I guess statements, jokes, provocations. That's what you're talking about.
Yeah, exactly. And getting rid of these interprovincial trade barriers, like a doctor from Alberta can't work in BC, like that's ridiculous. And so that's a positive that maybe we'll get rid of all this stuff.
Interesting.
I mean, we're all one country, so why do we got to do that to each other?
Yeah, interesting point, Lawrence. I was wondering that as well when our previous guests, in talking about a doctor shortage, suggested that those barriers, when it comes to being able to work in BC or different provinces as a doctor, be removed. We've heard that talk when it comes to trade barriers interprovincially. That's been coming up as well. And so, Bruce, what do you think of that as a solution? It's something that politicians seem to be pursuing now. What needs to be done there, and how successful might that be?
Yeah, I think that it's a great point, and I don't think it's going to be a panacea in terms of saving us from the U.S. tariffs if they come to fruition, but it's certainly going to help a little bit. And it's silly, to their call in to your viewers or readers' point. It's silly that we would have these barriers in the first place. It's really bad. So, and I know that Anita Anand, I believe, last week announced that about half the barriers are coming down. So, I wonder what it takes to get the other half down. That's probably the question.
Okay. And Shannon, when you hear our caller say, I'm very motivated, and he expressed very in strong terms there that it was offensive to hear talk of the 51st state. Is that a sentiment that you're seeing?
Very much so. In fact, there was sort of a funny comment. Someone said, the question is, what is your sustainability for your pursuit? And someone said, hold my beer. So that was kind of funny. And it is, there's a lot of comments. I'm in it for the long haul. This is it, permanent. Yeah. We're going to do it for the long haul this time. Whereas in 2018, it sort of faded off a bit. But I really feel like Canadians are emotionally invested this time.
Invested. Okay. I'm just going to make a point here that our computer screen has gone black right now, so I'm unable to see the names of the callers. If I could just have them said to me through my earpiece, that would be great, so I can call them. Tear Dad is our next caller now. Hi, Tear Dad.
Hello. I think our Buy Canadian approach is totally wrong. We are boycotting Heinz ketchup and we are boycotting Florida oranges. Mm-hmm. We must be boycotting Twitter, Facebook, Instagram, Amazon, and Uber.
The big tech companies.
If we want it to be effective, I also suggest boycotting the American military-industrial complex. Anybody remembers Avro Arrow? I'm still mourning the loss of Avro Arrow. Thank you very much.
Okay, Teardad, thank you very much. So going more toward the larger tech companies then. Teardad, thank you very much. And our next caller is Gabe. Hi, Gabe. Have I got that right? Is that Gabe from Sandsmith? Hi, Gabe. My apologies. Okay, my apologies, Gabe. We've lost. Paul is up next now from Maple Ridge. Hi, Paul.
Howdy.
Thanks very much for calling us. What do you think?
Well, I've been reading a lot and listening to a lot, and the Americans are always trying to get into our quotas for eggs, milk, beef, everything else. Mm-hmm. And I've watched a few programs over the years, and the Americans, they feed their animals antibiotics, growth hormones, and when a cattle gets sick, they give it enough antibiotics that it'll stand up. They put it in the auction, they slaughter it for meat, and they want to sell that stuff to us. Now I understand that we're not allowed to use growth hormones or antibiotics. Mm-hmm. And I always for years and years, look at the cheese and the beef and the chicken and everything else to make sure it's grown in Canada. Mm. Just because they want to feed us their sick animals and their antibiotics and growth hormones, and we don't do that in Canada.
Okay.
And we should make everybody aware of that. And I don't see that on any of the programs on TV, and I really think that people should be made aware.
Okay. Thank you for the call when it comes to dairy and meat products. And our next caller is Thomas now from Ladner. Hi, Thomas.
Hey there. How you doing?
I am fine. Thanks very much. What do you think of the Buy Canadian movement?
Well, I'm doing everything I can personally with my shopping, and it's been a major adjustment, but I'm enjoying it. I'm enjoying the hunt for... and that's not just Buy Canadian, but non-U.S. products. Mm. And my business is a small business. I manufacture musical instruments, and I've already begun migrating, purchases of raw materials to other countries. If I can't find it in Canada, I'm looking offshore, And yeah, it's been a huge adjustment, but I look at it this way: every dollar that I don't spend in the United States is a vote against Trump, and even more so against that political ideology. And so it's a point of pride for me. And
as a
yeah,
small business
Canada's
owner.
strong, man.
As a small business owner.
Yeah.
Yeah. Oh, well, thank you very much, Thomas, for the call from Ladner. And our next caller now is Maria in Valemount. Hi, Maria. Are you changing your shopping habits to try and buy Canadian?
Well, for me it is, I'm running a farm for many years, and I recently expanded my farm business and opened a little farm store right on my farm, very, very close to town.
Mm-hmm.
And I would say 95% of all my products are either I make them myself or produce them myself, or I invite local crafters and whatever I sell to sell it for them. But I also have a passion for books and board games, and so I'm also having a little section, a little tiny bookstore. And when I started ordering my whole books from wholesalers last October, I think it was, I found some really good wholesalers in the States, and I ordered a few books. But when this whole thing started with the Trump thing started, I changed that. I am only buying books and board games from Canadian wholesalers.
Okay. Maria, thank you so much. The idea of books. Haven't heard that before. Wally is next in Port Alberni. Hi, Wally. Are you changing your shopping habits?
The name is Waldi, W-A-L-D-I.
Hi there, Waldy. Okay, my apologies. Go ahead.
That's no problem. Yes?
Are you changing your shopping habits?
Yes, definitely.
Yeah.
I'm trying to buy Canadian only, if possible at all.
Okay, and what are the items that you've been able to find?
Well, everything from coffee to canned tomatoes to whatever I need to buy. Butter, dairy products, eggs, etc., etc.
Okay.
I'm on my own, so I don't need all that much.
Okay, Waldy, thank you very much for the call. And let me ask now my guests. I'm joined by Shannon McDougall and Bruce Winder. Shannon, are you finding that people are, you asked the question, right? How sustainable is this? What are the products that are hardest to find? What kinds of answers did you get?
I got a lot of people that are saying, if I can't find buying Canadian, I will buy anywhere but America is a common sentiment. But a lot of people are saying, I'm going to put in the effort. I've been finding what I need, looking at labels closely, because sometimes not all of the information is there.
Right.
And it's pretty much a commitment. It feels like it's a stronger commitment.
One other possible issue is the price. Are they finding price differences?
Yes, definitely. Some are finding different prices. However, what I recommend is that people go to local produce stores as opposed to superstores sometimes, farmers markets, and some are actually comparable or less expensive than the American comparable.
Okay, and Bruce, what sort of price difference might consumers be facing if they're trying to focus on Canadian goods?
Yeah, it really depends. It's all over the board. In some cases, it might be a little higher, but in some cases, it might be a little lower, especially if you're okay with store brands like private label, because usually retailers can offer, usually their private labels might be a little more local versus some of the national brands. So if you're okay switching to a private label, you might be able to get, it even cheaper a little bit.
Okay, what advice do you have then for Canadian consumers, Bruce?
Well, I think just do what you can. Try to buy Canadian. Try to buy from Canadian companies, like Shannon mentioned. Make sure you're comfortable within your budget. Realize it's not a pure science, that you can't. You're not going to find things that are 100% Canadian. But try to buy things that, as one of your callers mentioned, employs Canadians. I think that's probably your best bet.
What about for retailers? What advice do you have?
Well, I think for them, they should market products. They market products that are Canadian. Like I mentioned, I mentioned before, Loblaw, they've updated their app. So on their PC Optimum app now, they have a little button that allows you to say, okay, I want this to be a Canadian choice and a cheaper Canadian choice. So marketers can take a page from that and try to use in-store signage, update apps, do whatever they can to really sort of blow the horn about what Canadian products they have. And hey, if possible, maybe even try to change some sources to buy more Canadian products within their product mix they have in their stores or online.
Like we heard from our small business owner who called in, making musical instruments. What about yourself, Shannon? What advice do you have for consumers?
I would echo the same sentiment about doing what you can when you can. Some items are, of course, going to be more expensive. And I've always sort of had this belief that if we buy more Canadian products, they will become cheaper because there's more sales of the products. And you can confirm if that's correct.
He's nodding, yeah.
But
yeah, for sure, yeah.
Yeah,
Supply and
so if
demand,
there's a smaller amount being sold, they're going to be more expensive. So it's kind of a trade-off.
Let's take one more call here. So many people want to comment. Jeanette is joining us from Smithers. Hi, Jeanette. Have you been trying to focus on Canadian goods?
Hi, I have, and I spent half my time in Alberta, but Smithers is fabulous. There's a place called Out of Hand, and it has food and crafts as well, but you can get beef in this one store. You can get beef, pork, lamb, goat, wheat, locally done, herbs, desserts, bread, everything you can imagine, honey.
It's
like everything you can imagine.
You've got a feast there.
Look, and organic. I mean, it's organic beef.
Yeah.
It's organic pork. It's organic eggs. It's
and the price is okay for you?
Price is just fabulous.
Yeah.
Little pound of beef for $8. It's unbelievable. And the health food store is 2 doors down, and they get Fraser Valley cream, butter, all that kind of thing.
Jeanette,
but I mean, all this other stuff is Telqua, it's Smithers, it's super local, and
there you go. You've
products.
made the case for buying local in Smithers. Jeanette, thank you very much. And Shannon and Bruce, thank you so much. This is really something that's been anecdotally growing, and we'll keep watching it. Thank you for your time.
Thanks for having me.
Thank you so much.
That's Shannon McDougall, is the creator of the website and Facebook page Made in Canada Directory. Bruce Winder is a retail analyst and author based in Toronto. You can send us more of your thoughts. How's it been going for you? Shopping Canadian, buying Canadian? What's been the hardest? What's been easy? We've heard a lot of suggestions and experiences this half hour. You can email us, bctoday@cbc.ca.